Diagnostic imaging is fundamental to modern medicine, but patient access is under threat. By 2033, the U.S. faces a projected shortage of up to 42,000 radiologists. This isn't a future problem. Patients now face weeks-long delays for critical scans. Imaging demand is soaring, but residency positions are barely growing, creating an unsustainable gap. This video explains how virtual supervision is solving this crisis by decoupling presence from location. This operational shift is officially sanctioned. CMS has extended its allowance for virtual direct supervision through the end of 2025. This extension is vital for patient access, permitting short-staffed groups to better apply their limited radiologist resources. Consider contrast-enhanced studies. Hospitals without a full-time on-site radiologist can now perform these scans without delays. This virtual model is not confined to business hours. Teleradiology platforms provide round-the-clock access to radiologists, covering all gaps. But is it safe? An RBMA survey found zero negative impacts on patient care. In 30% of cases, response times were actually faster. So we know it's approved, safe, and improves access. Now let's look at the specific operational mechanics that make this system work. It directly attacks scheduling bottlenecks. Virtual supervision removes the administrative burden of managing complex on-site coverage. It's also financially viable. By minimizing costs for on-site staff, overtime, and travel, resources can be directed to patient care. The biggest efficiency gain is scalability. A single radiologist can supervise procedures across multiple sites at the same time. Imagine a network, 1 hospital, 3 outpatient centers. Instead of 4 radiologists for contrast coverage, 1 virtual radiologist covers all 4. This directly means fewer cancellations. If an on-site supervisor is out sick, the network doesn't halt. A virtual pool provides immediate backup. This efficiency is not theoretical. Let's examine how it demonstrably improves both the speed and quality of care. Making remote supervision permanent allows practices to significantly reduce report turnaround times, leading to faster treatment decisions. It also breaks down geographic barriers. A rural hospital can have a pediatric neuroscan read by a top subspecialist hundreds of miles away. This specialist access removes intermediate steps. Studies are routed directly to the right expert, stopping second opinion delays. Finally, it helps retain the experts we have. Remote work options improve job satisfaction and are a powerful tool against radiologist burnout. So, virtual supervision optimizes human resources. But what happens when we layer new technology on top of this model? Advanced platforms intelligently manage workflow. AI algorithms pre-screen scans, flagging urgent findings like a brain bleed for immediate review. This prioritization improves efficiency. But using AI to screen for life-threatening conditions raises a vital question. How do we ensure quality? The challenge is not a simple numbers game of radiologists versus scans. It is about managing complexity, acuity, and quality at a massive scale. Simply reading scans faster is not the solution if diagnostic accuracy suffers. The goal is to raise throughput while maintaining quality of care. This is where human and technological elements must merge perfectly. Let's connect these pieces to see the complete modern solution. Remember the 42,000 radiologist shortage? The one-to-many supervision model is the only scalable way to bridge that gap, multiplying each radiologist's impact. We asked how we can trust AI. Here's how. Leading platforms use AI not to replace radiologists, but to augment them as a powerful safety net. Those weeks-long delays are solved by a 3-part system. Virtual supervision opens slots, AI triages critical scans, and the network finds the right specialist. It's clear that virtual supervision isn't a temporary fix. It's a fundamental restructuring of radiology services to be more efficient and resilient. We've seen how this model is validated by regulators, proven safe in practice, and amplified by technology, optimizing the workforce we have. The evidence is overwhelming. Virtual supervision directly mitigates radiologist shortages and, as a result, significantly reduces scan delays. For administrators, this means stability. For radiologists, a sustainable career. For patients, it means a faster diagnosis and better outcomes. The time for debate is over. The time for implementation is now. Leaders must adopt virtual supervision to safeguard patient access to care.